in terms of what's up and coming. There's that polar bear study, which I talked about, which will change our treatment paradigm officially in the next few years, although people are already starting to adopt polatuzumab mini-R-CHP in our practice. The other study that is eagerly awaited, though it is many years from its final output, is a study of oral azacitidine added to mini-R-CHP, specifically designed for older adults above the age of 75. It's a large intergroup study, and it'll be very informative because it has a lot of correlates, which will just add to understanding of biology of lymphoma in older adults. But I think, we need to do something really paradigm shifting in this field. Just adding some stuff to mini-R-CHP, R-CHOP may not really cut it if we really want to improve outcomes. I think the next wave of studies which are in conception right now are, first of all, geriatric assessment-based studies. So you cannot design a bucket study with all older adults in the same bucket because of tremendous biological differences. The other thing is response-adapted studies. So PET scan is an imperfect tool, but it is still a very good tool. And the negative predictive value of PET scan is very good, meaning if it's negative, you can rest assured that, okay, the patient is doing well. If it's positive, there can be a lot of false positives, so contentious, but I think we can definitely use interim PET scans to start de-escalating treatments. The other powerful tool that is emerging is cell-free DNA or circulating tumor DNA. So we can use that as decision points to maybe escalate or de-escalate treatment. So start the patients out with R-CHOP or mini-R-CHP, but de-escalate if they're having a good response, or do the opposite, is start them on something chemo-free and then just escalate if they don't show a great response. So some of the studies are ongoing at MD Anderson. They're not specifically in older adults, but I think if the proof of concept comes through, then we should definitely apply it in older adults. And at MSK also, we are designing similar studies in older adults for the future. Have to be a little bit careful because recently there were 2 studies in our frail patients, so patients specifically who are the oldest of the old or weakest of weak, and the studies were looking at chemo-free options. So they were using antibody drug conjugates and rituximab to see if we can actually treat or even cure these patients without chemotherapy. These studies were done in the COVID era, and there were deaths which led to closing of the study, unfortunately. But it's subject to whether we are going to pursue these strategies or not. But I think these are the strategies that we need, and some bold steps to really try and change the treatment paradigm in the next few years.